It's more about just stopping any chains of transmission that might have already started while we've been or just going into the lockdown. I guess we'll see in a few more days whether we can move the rest of the country, the South Island, I guess specifically, out of alert level 4, or whether there are actually transmission chains that are happening there too.
At the moment, though, no cases have been confirmed in the South Island, as I understand it. Would you agree with those who say imposing a lockdown there is being overly cautious?
At the moment, we know that there are close contacts that have left Auckland and gone all over the South Island. None of those have become cases yet, and all the wastewater testing at the moment looks good, looks like it's negative there. But we're still in the incubation period for the virus, and so it's really important that we stay the course rather than moving out of the alert levels too soon.
Is it possible to tell yet when this outbreak might peak? Are you expecting the case numbers to rise in the coming days?
Yes, I don't think we're at the peak yet, and we've certainly had some, really some events that are probably super spreader events. So I imagine that cases will rise for the next few days and could get quite a lot larger than they are now. But we have to remember that we have been in restrictions for nearly a week now, and so the important thing is that they should have stopped, or at least really massively slowed down any further transmissions, at least outside of households.
This is the Delta strain that we're talking about, though. Are there any comparisons being made to what's happening in New South Wales and Victoria in terms of how quickly the virus is spreading?
We've certainly seen it move very fast. The fact that we've gone from 1 case to over 100 in just 6 days, we know that it moves fast. So they're certainly, being very cautious about looking at who are close contacts and looking at, infectious periods. The really important thing, though, is that our alert level 4 is very, very strict. So very few businesses are actually open. Most people should be at home. And it certainly looks like that from the mobility data. So, many roads are empty, many people are home, and that should have stopped any onward transmission.
So the lockdowns there then are stricter than what we're having here in Australia, and do you think compliance is likely higher in New Zealand as well? You're not seeing the complacency or lockdown fatigue that we seem to be experiencing here?
I think, our lockdowns are very, very strict. So, only essential workers are allowed to leave their homes. And we've got a very strict definition of what essential worker is. All our schools are closed. There are currently some help being given to people who have children who are essential workers, so that those children can still, be looked after while their parents are at work. But the vast majority of people are actually home. And it does look like certainly from the data of where the contact tracers are trying to get in touch with people, that everybody that they need to get hold of is home. And we've seen a little bit of we've seen a few protests, but they've been very, very, very small. And so the police have, so they've been called to a few things, but I think not as many as we've seen in Australia.
Well, Jacinda Ardern's saying New Zealand is absolutely aiming for elimination until more of the population are vaccinated. But how long do you think New Zealand will continue with this approach, given that this Delta strain does kind of change the game for a lot of countries?
I think that this idea of abandoning elimination and learning to live with the virus is really about learning to live with people dying. And we know that that would be a large number in New Zealand. And at the moment, that's not a number that we're willing to live with. So I think many countries are probably not making these calculations properly, that they're really setting themselves up for years and years of hardship, an impact on their health systems because of things like long COVID. And this is really not something that we want here in New Zealand.
Is it clear how this outbreak began?